Yeah, there's two things that are kind of remarkable about that to me. I spent a year working with Victoria Police a few years ago, and I did spend several nights out on kind of night shifts, and Melbourne was just a completely different place. I was just so incredibly struck by this was just a different map of the Melbourne that I thought that I knew, and clearly didn't. And then the second thing is just the ethnographic approach. It's sort of, you know, when data doesn't exist, it doesn't mean there's nothing happening out there, and so actually you just have to go and find out what's happening, because otherwise you miss it completely. We're going to open up to the audience for questions now. Can I just say a couple of things? Can you say who you are, and if you feel comfortable doing that, where you're from, just before you start? And can you wait before you ask for Liz to get the microphone to you, because we're recording? That's really important. So can I ask for a first question?
Ian Winter from the Australian Housing and Urban Research Institute. I've enjoyed reading recently Wilkinson and Pickett's The Spirit Level, their focus on relative inequality and the impacts of that on all sorts of corrosive impacts. How do you interpret your sort of focus on needs and absolute needs or relative needs, I'm not sure which sort of phrase you use, within that sort of a framework which is saying that perhaps far more important is relative income inequalities rather than studying poverty per se?
Well, for those of you who haven't read it, The Spirit Level by Wilkinson Pickett is a brilliant book looking at the very high level data on inequality cross-correlating with 101 other things which are undesirables. And Richard Wilkinson was involved in this a little bit in the early stages. In a way, we were trying to get much below the surface of the questions which aren't answered in that research and that book about the causal chains between inequality and other things which I think they still haven't quite got to understanding. They've supposed it has something to do with stress, for example, of more competitive environments, but they don't really know. And as I say, to relate it more to real life and qualities of life, where the income data, I'm for the same reasons I'm quite sceptical of GDP as a very good measure of prosperity. I'm actually also fairly sceptical about how much income distributional data really is the most powerful explanation of what's happening in societies. I think they've done a brilliant job in pulling it as far as you can, but it does leave so many questions unanswered, especially in terms of what you would then do. And the big weakness, I'm afraid, of say, Richard Wilkinson is that someone I admire hugely. But if you simply conclude everything is explained by income inequality, you're essentially paralysed, especially if you're in a political climate, as in Britain, where the public has moved quite strongly against greater redistribution. So it leads to, as I say, it's a politically immobilising set of conclusions at this moment. But the things which do, I think, where it starts connecting is, I think, in what we show in this report about how large numbers of people in more atomised, more competitive societies are feeling acute levels of stress, lack of opportunity, and how that is translating into psychological ill-being and illnesses of different kinds. And I think that's the thing to then explore what exactly is happening there in a country like Britain, which is unequal and has quite a few pathologies, a country like Singapore, which comes out very badly in the Wilkinson-Pickett analysis, but is a very, very different society, or indeed across the US states as they do. We do have a definition of need and so on. Let's get to the other part of your question. We drew our definition really from the work of Ian Goff and Len Doyle, who have quite quite a simple but quite a subtle definition. They describe need in terms of being those things without which you suffer socially recognisable harm. Now that is a definition which is neither classic absolute need or relative need. It certainly encompasses your need for enough food to eat and warmth and so on, but it acknowledges that over time what counts as socially recognisable harm will change. is therefore, I think, a much more dynamic, much more useful definition than really the very stale argument between absolute and relative poverty and so on. Interestingly, when we then did focus groups with people from all ages and class backgrounds, almost without prompting, when we asked them, what do you think of as need, they came up with variants of pretty much that same definition. You need the things which help you avoid socially recognisable harms, which may be loneliness, maybe mental illness, maybe not enough to eat, maybe not having a job, and that's another socially recognisable harm. And so we went round and round circles on definitions, but in fact we kept coming back to something around that. And I would encourage that, even though it's a slightly circular definition, because obviously part of what anyone wants to do in society is change definitions of socially recognisable harm.
Maria Katsonis from the Department of Premier Cabinet. Geoff, my question's around social innovation. In Victoria, we've got the beginnings of an innovation agenda within the Victorian Public Service, very internally focused about building capability. I've been looking at the work that you did when you were a thinker in residence in South Australia, which led to the establishment of the first Australian Centre for Social Innovation. I guess my question is around what do you see as the precursors, if you like, for the development of a social innovation agenda, and what kind of capabilities are needed towards that?
Well, for us as an organisation, the other prompt for trying to do this work is we were doing quite a bit of practical work on social innovation, but we felt we needed an intellectual underpinning which would tell us where innovation was going to be most useful, and that in principle should be where are their needs most acute, not being met, growing, and so on. So for us, this was a sort of the underpinnings of where should we direct innovation activity, whether it's creating new kinds of school or healthcare and so on. Alongside this work, our sort of parallel stream of work has been trying to build up so the self-knowledge, the toolkit of people doing social innovation around the world. And we gather together now, it's about 700 people and organisations in a network worldwide working in this space, and have just completed an attempt to pull together what is known about the methods being used everywhere from Bangladesh to Chicago to Japan by people trying to innovate new solutions to things like elder isolation, teenage unemployment, and so on. And we've gathered together about 528 methods.
About 500.
It may be 529 since I left. It keeps changing. Which range from research methods, ethnography methods, methods of finance, how do you run funds for innovation, how do you use design, how do you do commissioning, how do you scale things, grow them, and so on. It's full of case studies, essentially. And that will go online as a new website at the beginning of March. And as really a shared resource for this community across the world, which now includes very big programs like the Education Innovation Fund in the States, $650 million fund. In the UK, we are setting up over £200 million health innovation funds. The European Union is about to create several billion euro innovation funds. And each of the people running these are all now linked into this network, trying to raise the skills and capabilities of how do you do innovation as seriously and systematically as public services for the last 20 years have done performance management and improvement and other things. And our fear was that innovation was being sort of bandied around as a word, lots of rhetoric about it, but people just didn't have a grounding in the methods and the tools, and it was fairly random which method happened to be used in different circumstances without anyone knowing what works for what task, and we couldn't find this done anywhere at all in the world. So we essentially created a collaboration to build it up. And we're hoping this year to build off the back of this a kind of what we're calling a distributed virtual academy of innovation, where a number of big foundations across the world are funding it, and where we'll hope, I think we're going to have a centre in New York, one in Beijing, one in London, and probably 2 others, providing both some of the laboratories for testing out some of the methods, but also training up people in NGOs, governments, etc., on how to do this stuff better. In a way that happens in other fields like medicine. In medical innovation, there are lots of institutions, lots of funding streams, lots of evaluation methods. The social field needs to catch up and it'd be great if Melbourne was part of all of this.
No, we were just all thinking that.